Welcome everybody to the ASAP webinar series on PEPFAR Expenditure Reporting. ASAP stands for Accelerating Support to Advanced Local Partners, and we are doing this PEPFAR Expenditure Reporting for the third time in our series, and we will be repeating it closer to the due date of when you need to supply your information to USAID. So my name is Catherine Brokenshire Scott, and I'm the project director for ASAP. And I'm happy to present Erin Dunlap from USAID. She is a program efficiency and accountability advisor at USAID, where she has been for 6 years, and she's been in global health for over 14 years. I'd like to share a few notices before we get started. So welcome all local partners. We're really happy you're here. We had over 400 people register for this webinar, and we're really happy that people are joining in. We do have an opportunity for all your questions to be answered. If you see at the bottom of your screen, there is a tab that says Q&A. There's an icon that says Q&A. If you could write in your questions there, we will answer them at specific breaks. And then we will write up all of the questions with answers and send them to you. 30 minutes before the end of the webinar, we'll be launching a poll to get your feedback on this webinar. So please take the time to answer. It's very short, but we really appreciate the information. I'd also like to share that we store all of the webinar presentations and the Q&A on our website here below, intrahealth.org/ASAP resources. And on that site, we will record today's webinar, and we will email it to all the participants joining today. And finally, this webinar will be conducted in French on February 4th. My last slide is a presentation on the upcoming webinars. So the next one after this is on fraud, preventing, detecting, reporting, investigating, and managing cases and whistleblower programs on February 24th, and then also on March 3rd. February 25th, we're having one on gender equality, GBV prevention, and response services in USAID programs. We will have this posting every quarter to let you know what is coming. We are also in the process of developing a series for government to government. So this will be for host country government that are entering agreements with the US government. And we're also launching a series in Portuguese. So stay tuned for information on that. So with that, I'm going to stop sharing and hand it over to Erin Dunlap, our presenter for the PEPFAR Expenditure Reporting webinar. Thank you.
Hello, everyone. Thank you very much for joining. Some of you may be familiar if you joined any presentations last year on expenditure reporting or on the work plan process. And so want to thanks to any of those who are joining again, just for a little refresher, and a welcome to those who are new. So my name is Erin Dunlap. I'm a technical advisor at USAID headquarters. And today we're going to talk a little bit about the PEPFAR financial framework, which is inclusive of expenditure reporting. We'll go through the actual expenditure reporting template that you will need to create, that you'll need to complete, and how you submit that. Just want to note, many of you probably are aware, or those of you who may be new, that we just finished the last reporting cycle of expenditure reporting in December. It's an annual cycle, so don't worry, nothing needs to happen right now until about September or so for ER. We'll talk more about that here in a little bit. We'll talk a little bit about how we use financial data in PEPFAR. We'll talk a little bit about the work plan process, which will come up in about May or so of this year, and what partners need to know about that. And then some helpful resources for all of you. So as Catherine mentioned, please be sure to type your questions in the Q&A box as they come up. Don't be shy. I'll try to get to everything that I can, and we'll take periodic breaks during each one of these sessions here. So just an overview about, why we have this expenditure reporting process, and that's really because PEPFAR is, and USAID, PEPFAR being the broader umbrella, and USAID being an implementing agency of PEPFAR, that we're really committed to accountability and transparency of basically our US taxpayer dollars. So all of you are receiving those US taxpayer dollars, and we are entrusting that you are going to be good stewards of that money. And then we at USAID are managing that process as well, to ensure that we're spending our money in the right way, in the right things, in the right places. We also use this data for our strategic planning. So you report your expenditure data to us, and we get that data basically in January. And so right now we're in the middle of our strategic planning process and our budgeting process for the next fiscal year. So it's really to get at accountability, transparency, but also ensure that we have a data-driven process for budgeting and PEPFAR. I did want to make one important clarification, because I'm sure all of you are also joining, you've joined an ASAP webinar on financial compliance. And I just want to say that, what we're talking about with expenditure reporting is very different than the information that you learned in your USG financial compliance webinars, where the financial compliance is a little bit more about the documentation that's involved with US government funds, right? So you have to fill out your SF-425, you have your accruals, your liquidation reports, and you're sometimes submitting that monthly, quarterly, annual, things like that. With PEPFAR, with expenditure reporting, we're talking about data. So this is really more of a presentation and a conversation about data, which is very distinct from the documentation that you need. So expenditure reporting, we have basically one main template that you will use to show us how you're spending your money, and you're showing us how you're spending your money programmatically. So how much are you spending on testing? How much are you spending on adolescent girls and young women? For those of you that are, the budget analysts or the accountants, that's very different, right, than the documentation that you're submitting to USAID. So we're really talking about two different things, documentation versus data, and we'll focus on the data today. So I really wanted to, kind of go through the process flow of how expenditure reporting fits into the annual cycle, basically. So we start out at the beginning of the year doing POP strategy and budget planning. And this is only for the US government. So this is USAID, CDC, DOD. We all come together, and it's mostly at the country level, the mission staff, who are then setting budgets by intervention. They're setting a budget by a program area and a beneficiary. They're given a resource envelope for that country, and they basically need to plan every activity that's going to take place in Kenya for all of the implementing partners in Kenya. All of that needs to basically fit into our US government planning tool. And that's happening right now. That'll take place from now until about May. And again, that's just internal US government. But after we've approved all of our budgets and set all of our budgets, what happens is we then go into the work plan process. So we've said, this is what we're going to do strategically. And then we now kind of take it over to the implementing partners and say, here are your budgets, here are your targets, here essentially are the key activities that we're asking you to do. We need you to put together a work plan, and that will consist of a narrative and a budget template. And so that will be something that you work in collaboration with your ACOR. And so that happens basically in the middle of the year, from about May until September, where we're sort of tweaking and finalizing those budgets, so that when October 1st starts and we have a new fiscal year, you're ready to start planning and executing that budget. But what that means is once we close the books on September 30, once the fiscal year is over, once in September 30 of 2021, that this year is over, you will then spend October 1st until December reporting your expenditures from the previous fiscal year. So you'll have about 3 months, or you'll have about a quarter to tell us, how you expended your funds in the last fiscal year according to the expenditure reporting framework. And this is something that happens every year. So we go from high-level US government budget and strategic planning to the work plan process in the middle of the year, and then the end of the year is when we do expenditure reporting. So let's talk about what the expenditure reporting framework looks like. So you're essentially going to report to us on your expenditures that are by intervention. And an intervention is defined by a combination of a program area and a beneficiary. So that could be things like community-based testing for adolescent girls and young women, HIV clinical services aimed at adult males, things like that. That's an example of an intervention where we have a program area and we have a beneficiary. So really, this scheme aims to tell us what is the purpose of the funds. So that's sort of the program area. Who is benefiting from the funds that we're expending or that you're expending as the implementing partner, and that's the beneficiary group. And then we want to know what did you buy? What is the cost category? This is a sample of the expenditure reporting template, and all the numbers here are illustrative, so please don't read too much into the figures that I've typed in here. It's just meant to be illustrative. But what we're trying to focus on is when you receive this template, it will look just like this. And we're going to talk first about the first part of the intervention, which is the program area. And that's what I've highlighted there at the top. And you can see some examples. A program area is essentially kind of what it sounds like, right? So we've got activities at the site level that are related to prevention work for HIV testing, care and treatment, and socioeconomic. And socioeconomic is the term that we use to describe the work in our Orphans and Vulnerable Children program or our DREAMS program. Those are examples of site level program areas. We also have one program area called above site, and we have one program area called program management. Now, if you're new to PEPFAR and want to understand the distinction between site level and above site, an activity that is a site level activity is one that essentially occurs at the point of service. That's like a public health clinic or a public health facility, a private laboratory, a public pharmacy, where we can directly point to one facility or one point of service and say that we paid for someone's salary to work here, or we paid for supplies that supports this salary or for this facility. You can very directly relate the money to a particular location. That's really site level. It's point of service, it's point of care. When we're talking about above site level activities, those are activities that really benefit the entire country. So this is things like policy development. This is like a survey that we may do, where it's not just one clinic that's rolling out new policies. It's not just one pharmacy that's going to be implementing something new or doing some type of strengthening. It's the entire health system that we're focusing on. So that's really the distinction between site level and above site level. And the last kind of distinction that I will explain with program area is that for site level, we also go into the disaggregation of service delivery and non-service delivery. And what that essentially means is service delivery activities are those where the activities that are directly impacting beneficiaries. So this is where we're paying salaries for healthcare workers who are implementing service delivery models. We're paying salary for a doctor to provide services to folks coming into the clinic. Or we're paying salaries, or we're paying for other incentives for folks that are doing linking and referral services to treatment. Those are examples of service delivery where that money is directly going to impact beneficiaries. Non-service delivery examples are more related to capacity building, site level supervision, mentorship, technical assistance, where we're really just building up perhaps the site level staff to, maybe they just need an in-service training. That's an example of non-service delivery activities where we're not really spending money that's going to benefit the beneficiaries, but we're spending it on the folks who are going to interact with the beneficiaries. So those are examples of service delivery, non-service delivery.
Hi,
Yes. Yes.
I'm sorry to interrupt, but I'd like to jump in. We're getting feedback requesting for the presenter to speak more slowly so everybody can
Sure.
grasp that we do have people where English may not be their first language. So thank you for that.
Sure. And I also just want to note that we have definitions of all of this information that I'm presenting. So if it was a little overwhelming to absorb examples of service delivery, non-service delivery, or site level and above site level, we have a guidance document that will have all types of explanations and definitions and inclusion and exclusion activities to help when you do this reporting. I'll go through some examples of program areas here. You can see that we see care and treatment, testing, but you can see also on the right, we have examples of what are called sub-program areas. So let's just take care and treatment as an example. So just within care and treatment, we don't want to just stop at this is what we're spending on care and treatment. We want to know a little bit more information about those care and treatment activities. So things like clinical services, which is very distinct activities that are different from laboratory related expenditures, which is different, very, very different from expenditures related to what we're spending on HIV drugs. So we like to disaggregate our program areas, and you can see the same with testing. We don't just stop at testing. We also are looking at facility-based testing and community-based testing. And you can also see there in the sub-program areas that we have every category has the distinction of being either service delivery or non-service delivery. So again, don't feel too overwhelmed by all of the information that we have here because there are definitions with a lot of examples of activities in each one of these. In the interest of time, I'm just going to kind of briefly kind of skip through the next couple of slides because of that documentation that I'll ask you all to refer to on your own. But again, we're still looking at prevention and we have examples here of community mobilization, voluntary male medical circumcision, PrEP, condom and lubricants, opioid, etc. So again, please look at some of this information on your own. Here is socioeconomic. This is again our Orphans and Vulnerable Children program and our DREAMS program. And those were all examples of our site level program areas, sub-program areas. Now, we talked about there is an above site program area. And now you can see in the right, we have examples of sub-program areas listed here. Again, these are all direct activities. These are none of these activities that you see here on the right of the box are related to program management or indirect. These are all direct activities that you are implementing to support the health system or capacity building or something of that nature. So again, all of the definitions for each one of these line items is in the classification reference guide that we'll talk about at the end on where you can access all these definitions. And then our last program area that we have is program management. And essentially program management is inclusive of your organization's management and operations costs. It's your admin and finance staff. It's the operating costs for your office where you're located, the rent, things like that. It also covers what's called a NICRA, which is what mostly international partners have, although some local partners have. And that's essentially just your indirect costs. It's a percentage. And then also your de minimis, which you might remember from your previous webinar on financial compliance. So that's that 10% of overhead that is your overhead, essentially, is your de minimis. So all of that is essentially allocated in the program management area. So we want to distinguish the activities that are more programmatic in nature and that are more direct costs from those that are indirect costs, that are more administrative operations and finance in nature. So you'll see that on the expenditure template that we just separate that out. It's very clear, as we can see right here. So The next thing that we're going to talk about after program area, we just set part 1 of our intervention aside, and we're now going to go to the beneficiary. So that's that second row that I've highlighted on our expenditure reporting template. And it's kind of how it sounds, right? Essentially, a beneficiary is the intended recipient of PEPFAR programs and PEPFAR expenditures. And as we'll see here, the beneficiaries really relate to the indicators and the folks that we're targeting with our indicators. So you can see things like our key populations. So men who have sex with men, sex workers, transgender. We have pregnant and breastfeeding women. We have our priority population, like our truck drivers, our fisher folk. And we also have orphans and vulnerable children. So those are some of our key populations. You can also see that we have also just demographic beneficiary groups. Sometimes we're targeting adult males, or sometimes we're targeting young girls. And so those are some examples of some of the age bands within some of those demographic beneficiary groups. And then we have something called non-targeted population group. And that is essentially, when you have an activity or you have expenditures that are either for the general population, we're not targeting one person in general, or maybe we're targeting more than one population. Maybe we're targeting sex workers and females. And so rather than disaggregate each one of those groups out, we might just put them in non-targeted population and just say it's a combination of both. And similar to program area, you can see here, and as I've mentioned, we have sub-beneficiaries, right? So if we take females as an example, we have adult women, young women and adolescent females, and girls. And again, that non-disaggregated, which is sort of, we're targeting more than one group of women, let's say, or more than one group of females. So I'll not go through too much more detail. This is all available in our resource materials, but that's an example of the second part of our intervention, which is the beneficiary group. So now let's put those two things together, and we have program area and beneficiary, and that's what we call a PEPFAR intervention. And we have an example of this right here, right? So let's put that together, and we're looking at expenditures, and we're setting budgets according to this framework. So we're saying, let's take this as an example of an implementing mechanism, of a project. When I say implementing mechanism, it's sort of the project that you're implementing right now. This is an example of the program area, the sub-program area, the beneficiary group, the sub-beneficiary group. It's the combination. We're talking about how much are we spending on a community-based testing activity that is targeting sex workers. Or let's go to intervention number 2. We want to look at expenditures related to education assistance aimed at orphans and vulnerable children. Or maybe what our investments are to the general population, a non-targeted, non-disaggregated beneficiary group at our care and treatment clinical services. So as you can see, what this essentially is telling us with your financial data, it's telling us a story about what you are doing, throughout the entire year. How did you spend your money? You spent it on testing, you spent it on treatment, maybe you spent a little on prevention, you focused on young girls, you focused on pregnant and breastfeeding women, and you focused on adult males. And you invested this much in that program area and that beneficiary group. So when you really think about it and you sort of take off your accounting hat, with expenditure reporting, this is why I was saying it's looking at your expenditures more through a data lens. It's telling a story to us with your data about what you're doing that we could never know just from your other financial reports. Your SF 425, your pipeline reports don't tell us any of this information about the good work that you're doing. So that's how expenditure reporting is different. So without going into too much detail on this, essentially, you all are doing, some of you are probably doing a lot of different activities that cover many program areas and many beneficiary groups. And so, you know, even for something like a $5 million program, you could be working across 7 sub-program areas and you're targeting 6 or 7 beneficiary groups. That starts to stretch a $5 million budget up quite a bit. And so I think USAID wants to, and we understand that, and we want to strike a fine balance of knowing when we can lump some activities together and say, you know, we understand that you work with pregnant and breastfeeding women and you work with another beneficiary group, but go ahead and combine them, because we understand that one may be a small amount, one may be a bigger amount. Let's just go ahead and combine for the sake of brevity. And that makes it a little bit more manageable for you as the implementing partners, because it would be a lot to ask, especially since your accounting systems aren't set up this way. It would be a lot to ask you to, you know, basically track and monitor your expenditures 100 different ways for something like a $1 million or a $5 million budget. That's kind of a lot to ask. So we tend to stop at about 35, and that tends to give us the right level of information for us to do data analytics and say, you know, we're still able to, with good confidence, run a report on how much we're investing in adult women in Uganda, or how much we're spending on care and treatment in Burundi. You know, we want to be able to have the right level of detail to give us information for decision making, to understand how we're spending our money, but without making it too complicated for monitoring and reporting. Okay, that's PEPFAR interventions. That's that first row and that second row. Now, if you remember that annual cycle that I showed you of the COP budget, the work plan, the expenditure reporting, and I said that we're in the COP budgeting phase right now. So the US government is working on giving you program area, beneficiary, and we are also assigning, the mission colleagues are assigning a dollar amount. So the total down there at the bottom. And so you will get this information from your ACOR at about May. They're setting your budgets for you right now according to this framework. What you as the implementing partner will be responsible for the work plan process is to give us the detail that I've highlighted here in the middle, which is called the cost category. So if we take that first column, USAID will give you facility-based testing for service delivery aimed at adult males for $775,000, which we see down there at the bottom. But you will need to tell us what the middle part is. You'll tell us this for the work plan budget, and you will also tell us this for expenditure reporting. So what are some examples of cost categories? For those of you who are completing the financial reports, you can see that with the exception of probably training, these are all similar to how you are already reporting your expenditures and other financial documentation. And so again, we have examples and definitions of our cost categories and our sub cost categories that I will not go into in the interest of time. But this is just an example of, again, we want to know what we're buying with our dollars. For community-based testing aimed at men, what are we spending in each of these categories? For HIV clinical services aimed at young girls, how much are we spending in these categories? That's what we want to understand with expenditure reporting. This is how we set budgets. So I will stop there. I realized that was a lot. This was the longest section, so thanks for sticking with me. Every section after this on the template and on data use will be much shorter for breaks, but happy to take a few questions now.
Thank you, Erin. We have 2 questions right now. The first question is from Eddie Kubuka. He asks, how do you report VAT for apportioned costs between USAID and non-USAID projects?
So I cannot speak for the non-USAID projects. That will, how you report VAT will depend on, you know, how how you need to report based on the guidance that you're given from them. But you know, reporting in VAT is something that VAT is something that you have to do for expenditure reporting. I believe in our guidance that is something that is categorized in an other cost category. I can get back to you on that in the question and answer that we'll send out later, but the VAT is something that you spent money on it, you're being reimbursed, but it is part of the expenditure.
Thank you. The second question is from, I hope I'm pronouncing this right, Renette Mawir. When do we lump expenditures? I'm not sure that's very clear for you.
So it's a good question. This kind of gets at what I was saying, that we set budgets using this, we set budgets and we report expenditures according to the same template. So you will see in May, you're asked to report how you will spend your money. And then a year from now, you're going to tell us, did you spend that money the way that we set the budget? So it's the same template, and it's that one-to-one that we really want to see is budget execution. If we say that, let me go back to this example here really quickly, just so that we can kind of all be on the same page. The expectation is, let's pretend this is a budget template, and you're filling this out for the work plan. Your expectations as an implementing partner are very clear on how we expect you to expend your budget. So for that first example of facility-based testing for service delivery for adult men at the 775,000 level, you are given that amount by USAID, and USAID has taken those decisions on when to lump and when to split. So you won't have to worry about saying as the organization, you won't have to define the interventions. They will be defined for you by USAID. You will need to give us the cost category detail. So that's one part of my answer. The second part is that we understand that there are a lot of these interventions that are cross-cutting, right? It's not easy to tease out what a healthcare worker, how much we're spending on a healthcare worker that's doing testing and treatment and maybe even a little bit of prevention as they're dealing with folks that are coming in the clinic. And so I guess I'll say this, it's a little bit of an art more than a science. And there are some things that we do leave up to the implementing partner to decide regarding that middle part of the cost category, right? So what amount you have to stay in for your expenditures. But if it's easy, I think it's how you want your program and how you want your expenditures to be reflected, and of course based on reality. But I think if you're able to estimate, let's say we believe that, and most of the clinics we work in, that the LOE of healthcare workers is 60% care and treatment and 40% testing. Let's allocate 60% of our personnel salaries, healthcare workers, to care and treatment, and then 40% of that lump sum amount to testing. You might break up that cost category and allocate across more than one intervention. It's an art more than a science. I would say, expenditure reporting is your best estimate. It is an estimate, and we understand that. This is another way in which it's different from your financial compliance documentation. That is subject to an audit. Expenditure reporting is not subject to an audit. It should be correct as much as possible. It should be accurate, but it's not subject to an audit. So I say, my guidance on that is, do your best to estimate as close as possible what your spend is, but we understand that it can often be difficult to estimate. And so, when you complete this template, it should be easy for you to look at the full picture of your spend in the last fiscal year and just do a gut check, right? You can see down there at the bottom that there's a calculation of the percent across down the intervention. So you can see, we spent 18% on testing, 28% on socioeconomic, 16% on prevention. Does that make sense to you? And then go across I'm not showing it in this visual, but you can do the exact same thing with the cost categories. Do you think that you're estimating the right amount for personnel, for supplies, for contractual? That all should be pretty that all should be pretty obvious to you because your accounting systems are set up that way. But I think the detail is, how you split it up and how you lump it together, whatever decision you make between the interventions.
Okay, we have a few more questions. For NICRA, what is the maximum percentage can be requested on the budget? I do want to share that ASAP has separate webinar presentations on NICRA and 10% de minimis and financial management presented by Sustainability Solutions before you answer, Erin. So thank you. Go ahead.
Sure. The NICRA de minimis indirect conversation is a complicated one. So a NICRA is the negotiated indirect cost recovery agreement, and it is essentially something. It's the indirect cost percentage that you apply to your direct costs. So when you're being reimbursed for your direct costs with your invoice every month, you basically will apply a percentage of your, and that NICRA is negotiated, it's approved, it's final. It happens between an organization and USAID, and you're given those percentages, and they cannot change. Once they're set, they're set. And then that's essentially, the percent of the estimate of your indirect costs that are applied to your direct costs, and that sort of is what you're invoicing USAID every year. The NICRAs are typically mostly available to international partners, and the local partners tend to apply the 10% de minimis. That's about all I can say about that. I might, like as Catherine said, I think there's a little bit more information that ASAP can provide to you about that, but it's not really something that is negotiated more than once, or those tend to be very fixed amounts for the duration of the award, the best of my understanding.
Okay, and ASAP is working with local partners to make sure that you're advocating USAID to get your 10% de minimis, which you are all eligible for. The next question is cost share included in this report?
I think this relates to cost. I'm not entirely sure. I think this might relate to cost sharing with like other non-PEPFAR spend, perhaps. I'm not quite sure what this refers to. We'll get into the kind of the methodology here in the next section, but expenditure reporting is only reflective of PEPFAR funds. So if you work on, let's say you work 50% on a PEPFAR project and you bill 50% of your hours to a non-PEPFAR project, we only want to see those expenditures that are related to PEPFAR, or like office rent or something like that. If you are implementing more than one mechanism as an agency, or I'm sorry, as an organization, you only report to expenditure reporting the amount that is sort of proportioned for PEPFAR. I think that's the cost share question.
Okay, so just to define, cost share is a percentage that USAID puts into cooperative agreements. So often you'll see 5% cost share, and that's often government contributions to an activity. So just to define that. So the next question is, how can we fix a clear boundary between interventions while reporting? So that is the key issue here, and that's why we're having this discussion, is for program people to work with finance people so that you can set up your system so that you can have these boundaries between interventions. You want to add to that, Erin?
Yeah, we've talked about this a little bit in previous webinars, and I guess this is just an example for you as an organization to think about. Again, we have that financial documentation, which is very straightforward. It's basically it's what we're seeing in the object class cost category in that first column, right? Like that's very clear. Like your systems are already set up that way. But you also now know as an organization that you need to be tracking your expenditures, your spend according to this framework as well, which is different. And your accounting system is not necessarily set up this way. Your timesheets may not be set up this way. And so, I probably should take a survey from someone that could, we actually have time at the end for this, but, I don't have a good best practice as to how necessarily you need to internally keep track of your expenditures. But you do know that this is an annual requirement. This is how USAID is expecting you to expend a budget. And we understand there's differences and things are going to change and there's variances and things like that. And those are conversations to have with your ACOR as you experience roadblocks and barriers and things like that. But this is the expectation. And as Catherine said, it's really a conversation that needs to happen with some finance folks, with some program folks to say, okay, the finance people understand one piece, they get the spend, but they may not understand, okay, how are we going to report all of this by the interventions, by the different columns? And the program people may say, we know at a high level what we're spending on the different interventions programmatically, but we don't get into all the weeds of the indirect costs and the contracts and stuff like that. We don't really know all the details. So that's why you have to really bring the two together so that when you're doing your ER, you can sort of tease out these amounts in order to report accurately. I'd be really happy to take some time at the end if anyone has any best practices on the best way to do that. I think if you can find a way to do a reconciliation on a monthly or maybe even a quarterly basis so that you're sort of taking what's in your accounting system and you're putting it into this framework, maybe do an ER template once a quarter or once a month, do that reconciliation fairly regularly, because if you sit down to do it at the end of the fiscal year, you might forget what some of these activities are. I don't really remember what was in some of our economic strengthening or some of our clinical, or I don't remember between some of it sounds distinct. It gets a little more complicated when you have multiple beneficiaries as well. So that would be one recommendation.
Okay, the next question is related and is a good idea. So this person includes percentages in their work plan budget, percentages for expenditures. So should they just use what's in the budget for the work plan? And another question on how do you report associated VAT?
Right, I think we had that question on VAT before, and we do ask that you report the VAT because it is a cost that you did incur throughout the year for the services that you received. We understand that you reimburse them, but you're reimbursed for them, but you can still report them. Like I said, I would have to get back to you on the specific cost category, but I believe it's the one at the very bottom there that's other. I think that's where VAT goes. The question on percent of budget in the work plan, I think, like I said, USAID is going to give you that first row program area, the second row of beneficiary, and the one of the second to last row at the bottom, the total. We will give you that in May. Your ACOR will give you that information so that, and then you will need to give us the middle part. And I think, if you have a percent estimate of, we spend roughly 30% on testing and 20% on prevention and 10%, it's not going to be just like a super straightforward percent. You might have to kind of start with the percent allocations and then tweak from there into a little bit more of a finer detail, but that could be a good way to start. Yeah, I'll stop there.
Okay, last question, which is also somewhat of a repeat. In most cases, the accounting software of the implementing partner does not support the PEPFAR cost classification requirements, and this means that the partners are required to conduct further activities to meet the requirement. So in this case, what is the accuracy level that you expect from your partners in relation to ER?
To respond to the first part, the object class or the cost category actually does align, with the exception, I think, of training. Training is the one component that probably does not appear in your pipeline reports. These are disaggregated, but you at the very least should have a top line personnel, top line fringe, top line travel, top line equipment. That is all aligned, and that was purposeful so that we can make this easier for implementing partners. Now, you may not have it broken down by healthcare workers and other staff, but you can at least, you have a starting point, right? And so that's where that conversation with the program staff needs to come in. You as the accountant can pull the number for how much you're spending on personnel. You need to sit down with a program person and determine the estimate that they're making on a healthcare worker versus an ancillary staff or something like that. And as I mentioned, expenditure reporting is a best estimate. Again, we are looking at your data. We'll talk about that here in a little bit. We'll show you how we're looking at your data and how we're using your data for budgeting, for understanding performance, for triangulating with target achievement. So you want this to be as accurate as possible. But again, we do understand that it's a best guess. You're not always going to know, everything down to the dollar and to the cents. But it's important that you do your best effort because it is reflective. You're telling USAID what you did. And so, I think it's in your best interest to try and make that as accurate as possible.
Okay, and one more question on that topic is how much flexibility do we have under program management to recover the fluctuating rates for NICRA?
So, you will report your expenditures in US dollars, and you will choose a conversion rate that you will use for your other financial reporting. And I can't answer that question for you on what conversion rate you use to submit other financial reports. And I also can't answer the question on what gets reimbursed due to the fluctuations. I think that's more of a question for like an AO or a CO on authorizing reimbursement for those fluctuations that we all know happen all the time. I believe they tend to be reimbursable, but I'm not an agreement or contracts officer. So that's a question to ask of them or to ask of your ACOR on what to do. But it certainly is something that impacts everybody.
Okay, thank you, Erin. Back to you.
Okay, we have about 4 more sections left. So these are, like I said, a little bit quicker to go through, but I just want to make sure that we have plenty of time for questions. So now we're going to talk about how you complete the template and how you submit it. So I mentioned that, right now we are in the first phase in the COP strategy and budget phase. We're in that number 1, that red box. We just finished expenditure reporting number 3 in December. Some of you may have already submitted a report. Some of you may have not, but it basically is the reporting cycle ends in December. And that's when you send us your report and you say, this is what happened in the last fiscal year, we're done. So nothing needs to happen right now. Essentially, reporting will happen, but everything kind of kicks off on October 1st. And we spend a week or 2 before then to send out materials and make sure you have all the resources that you need. But we need to wait until the books close on the fiscal year before we can start reporting on it, right? So we often get asked by implementing partners, this is a terrible time of year to do expenditure reporting. Why do we have to do it from October to December? It's just, there's so many other reports that we have to fill out. And that's because we have to wait for the last day of the fiscal year to close. And once September 30, we go from October 1st until September 30, we have to wait for September 30 to end so that starting on October 1st, it's a new fiscal year, you begin implementation on a new year, but then you spend a quarter looking backwards and you spend a quarter reporting on what you did in the past. And we do give you that time, but we need to wait until after the fiscal year closes and a new one begins, and you spend the first quarter of the new fiscal year reporting. So again, you can see here that nothing is happening anytime soon, but this gives you an idea of what the calendar looks like. We essentially give about 6 weeks for you to review the resources, the documentation, to meet internally and to sort of put all the numbers in boxes and then submit the template. And that's our data collection window. And then internally at the US government, we process that data and we take a look at it. And once we analyze it, it's possible that your ACOR might have questions once they can see it all analyzed. And they may say, hey, you know, actually you're missing about 2 million of expenditures, or I thought you did a little more care and treatment, but you're saying that you did more testing than care and treatment. And so we have a data cleaning window where everything kind of turns on again, and you've got another 6 weeks or so to basically make any corrections. So it's about a quarter of reporting that can happen where you're reporting and reviewing and possibly revising. But essentially everything needs to be done by the end of December. And then that is in order for all of the data to be processed and analyzed. And it's now available in January for all of us at USAID and CDC and the other agencies to start looking at it, analyzing it, and then using it for the budgeting process. The one thing I do want to note is that the submission happens in an online system called Datum. And I have a slide on this here in just a second, but I'm not going to spend much time on it because it's very, you know, in the weeds on an online system, and we don't really need to do a demo of that. But the long story, or the short story of it, is you complete your template, you go to this website, and you enter in some credentials, and then you submit your template that way. So you cannot email your template to USAID. It will not be accepted that way. So, you know, every year we always get a few people that are just saying, here you go, here's my template. And, you know, we will not do that. So make sure that you plan time in your reporting to figure out the technical stuff, your accounts, any technical delays. There's always a lot of traffic on the last day or two. So, you know, this is not something that you can wait until the last day to submit a template, because there is a whole other technical component for submission. Okay, so that's sort of like the time frame in which we're working in. So let's talk a little bit about the reporting process and the methodology. Basically, you must submit one expenditure reporting template for each implementing mechanism that you're operating. And we use the term implementing mechanism, but that's just like the project that you're working on. So if you are an organization that has, let's say, 2 projects or 2 implementing mechanisms in Mozambique, you've got not just, you're working on, you're implementing 2 as an organization. You cannot just combine that into one and say, all right, this is organization A's submission that's inclusive of 2 projects. It doesn't work that way. They are 2 different activities with different cost structures and all kinds of things. So it's one template per implementing mechanism. Now, maybe you're an organization like Equip, where you're, you know, working in more than one country, one mechanism that's working in 3 different countries in Southern Africa or something like that. You cannot submit one template that includes the expenditures for all the countries that you're working in. Again, it's one template per country, per project. So it's very distinct. And again, don't get too, you know, caught up in the weeds on this, but just want to make it clear that you can't combine. Everything is very distinct. If you have an award, you've got to have an expenditure template for every single one. Something that, again, is different from some of your compliance documentation, expenditure reporting is based on a cash basis of accounting. So let's say that in September 29th of 2021, you have a big purchase and it doesn't leave your bank account until October. You actually will not report that purchase in expenditure reporting for fiscal year 21. It would be reported When that money leaves your bank account, and if that's in fiscal year 22, then you will report that expenditure in fiscal year 22, even if the expenditure is sort of accrued or it's related to the activities that are happening in fiscal year 21. So it's a cash basis of accounting. Something that's important to mention, I think I said it earlier, but you will only report on PEPFAR expenditures. So we do not want to have if you receive other funds from USAID, like malaria money or maternal and child health money, you do not include that. It is not related to HIV. It is not PEPFAR funds. You only report on your PEPFAR funds. If you receive other HIV money from another organization or entity, like the Gates Foundation, let's say you're doing some HIV work with them, you do not report that as additional HIV. It's only USAID PEPFAR funds that you receive for expenditure reporting. We talked about this already, but you must report your expenditures in US dollars. Again, I don't have a conversion chart for you. You just need to use the conversion rate that you used for other financial reports. The prime partner is responsible for reporting all of the expenditures in the last fiscal year, and that includes what your subrecipients spent. As of today, your subrecipients do not need to complete an expenditure reporting template. That Excel sheet that we've been looking at, you just need to collect a certain level of information from them on my subrecipient spent this much on this intervention. And I don't need to know personnel and travel and supplies, etc. That's the guidance that we have today. You still have to include what the subrecipient spent, but you as the prime partner are responsible for it. There's discussions that might change, and that perhaps for fiscal year 21 reporting that happens in October, that your subrecipients might complete a template, but that is all sort of, it's up for discussion right now. So I want to sort of prepare you in case that does happen, but as of right now, it is not guidance. But at the very least, we need to know what your subrecipients are spending, just a lump sum amount. And then finally, again, we're talking about your expenditures for a fiscal year. You do not need to report expenditure reporting on a quarterly basis or a monthly basis. Your only contractual requirement is to report your expenditures on an annual basis for a fiscal year, which runs in the current fiscal year that we're in, October 1st, 2020 until September 30, 2021. And so this is an example of the ER template. And this is familiar, right? We've been looking at this as we've been going through our examples of the program area and the beneficiary and the cost category. And you can see here I've highlighted basically what I've already mentioned before, is that USAID is discussing the budgets right now, and we're setting your budgets by intervention. We're setting that first row, that second row, and the corresponding amounts. So sometime in April or May, your USAID ACOR will give you your budget by intervention for fiscal year 22, and it will look somewhat similar to the green and gray box that we're seeing up in the right-hand corner. And again, number one, this is letting you know how to complete your budget template for your work plan requirement, which will look exactly like the ER template. But it's also ensuring that you as the implementing partner are clear on your budget for fiscal year 22. Not just you get 3 million and it's broken down by 5 different cost categories. It's you get a budget of 3.3 million, and this is how much you have to spend on community-based testing. This is how much you have to spend on prevention. This is how much you have to spend on care and treatment for all the associated beneficiary groups. So all expectations are clear in May in advance of the start of the fiscal year, which is October 1st. So your expenditure template, again, when you report it's going to be in this online system that I mentioned called Datum. And this is sort of a snapshot of where you go, what it looks like. There's all kinds of documentation and guidance material on how to do it that I won't spend time on. But like I said, don't underestimate, there is a technical component to this. It's not just filling out an Excel file and emailing it. You will need to create an account. You'll need to upload it. You'll submit it. You might have errors. You might have a lot of things going on. So just plan for that. And I think the last thing I have here is that this might be a little overwhelming for some of you to think about. How am I going to do this? We've got 9 other reports. You know, this seems like a lot. So I just want to let you know that there is technical assistance that is available to you. I sit at USAID headquarters. I am one of the kind of the ER advisors, and so I support 4 or 5 different countries where if there's questions, you know, you can always go to your country-based USAID ACOR, but they also may loop in someone from headquarters like me and say, hey, an implementing partner has a question on allocation or categorization or something like that. So just know that you can always go to your USAID ACOR, and then they are in touch with, there's 6 or 7 of us at USAID headquarters that are also assigned to a country that can answer questions. And so, you know, I think the real takeaway here with expenditure reporting is, you know, you're given a quarter to do it from October to December, but, you know, you don't want to wait because it takes more time than people think it does. And it's not just a matter of sort of filling in a few numbers and boxes. Oh, we're given 2/3 of you know, the budget. Anyways, there's not that much to add in for the expenditure side, but it really does take time. You know, it's that conversation between program and finance. It's really taking a look back and saying, did we expend according to how we were budgeted, things like that. So do not underestimate the time that it takes to do this. We give you a quarter because we think it actually takes a quarter. So I'll stop there and take more questions.
We have one question right now. Take as example where the report currency is US dollars. Which conversion rate should we use? From the bank where it's located, where the account is located, or is there an official website for us to use?
Sure. You know, I can't give you an exact answer to that. You know, our guidance is that whatever conversion rate you use to submit your financial reports, like your other financial documentation reports, that's the conversion rate that you should be using. And, you know, I don't have the answer to that question specifically. It might be, I think that actually is maybe a question that is good to have between, you know, the finance team and perhaps your ACOR or your agreement or contracting officer. There's a lot of websites out there with best practices and best, you know, best recommendations, but, you know, that's something I can't answer.
Okay, from an organization's perspective, they often use a fluctuating exchange rate where you do have a source that you can go to. And we can include more information in the written answers.
Yeah, I think, oh, sorry, I was just gonna say, I mean, I think, you know, as long as whatever you're using is sort of an industry standard and it's documented, I think that's a good best practice. And again, I encourage you to reach out to other, you know, your USAID representatives to discuss that plan and ensure there's agreement. I think that's the best way to deal with it. But I think, you know, documentation on that is important.
Okay, then there's a question in the chat. Does expenditure reporting template go with evidence of payment?
So this, I'm not aware of evidence of payment. I think, again, that is one of the pieces of documentation that is on the compliance side. That's part of the terms and agreements of your award, I'm assuming. Again, expenditure reporting is a contractual requirement. It's in the terms of every single award that PEPFAR, every single PEPFAR award, it's in the terms, it's a reporting requirement. But it may differ, and actually it probably will differ, because I believe your financial compliance documentation is based on accrued expenses, whereas ER is going to be based on a cash basis of accounting. So in some cases, we wouldn't expect there to be an alignment if that's the case. And I do believe that's the case, that we wouldn't expect an alignment if you're using two different accounting methodologies. And so I think as long as you're have a checklist, keep on top of what your financial reporting requirements are. If that's one of them, then you just want to be aware of what that is, what is needed, the documentation required, and the timeline of it. And then you need to have that similar kind of checklist and requirements for expenditure reporting as well, to know exactly what you need, how to do it, and when it's required and when it's due.
Okay. I'll ask you some more questions at the next session.
Okay, great. We're getting a little quicker as we go on here with they're getting shorter. So I wanted to spend just a few slides here on data use. As I think it's important for our implementing partners to understand that, we recognize you're spending a lot of time completing an expenditure reporting template. And I want you to know that it is not just an Excel template that sits in a folder on a computer somewhere. That in PEPFAR, we are extremely data driven, and the financial performance component has only continued to become more and more of our conversations. And so I wanted to just walk you through some of the questions and some of the caveats and some of the things that we think about when it comes to expenditure data. And so you can see, when you think about that expenditure template, and you're telling us how much you're spending on program area, this is one way that we can look at expenditures. We can look at this by program area and get an idea of what our share of expenditures is, for a given fiscal year. We can look at changes that may happen over time in both the levels as well as the proportions. We can look at this for just your mechanism. We can look at this for just USAID mechanisms. We can look at this for an entire country. We can look at all of this globally. And so we take the information that you give us and we can look at it in a very aggregate or a very disaggregate way. But this helps, it helps the mission country managers who are right now planning budgets and are right now discussing strategies. What do we need to do in order to get closer to epidemic control? Are we investing enough in treatment? Maybe we're over testing. Maybe we need to spend more investments in prevention. This is one way of looking at data, thinking about the questions that we have, and are we working in a way that's investing our dollars in the right way, in the right places, on the right things. That's just an example of looking at program area. We can also do this on the beneficiary side as well. So this is, again, we can see, if a given country, let's say there's a country I have in mind that I know that the epidemic is really driven by adult males. And so, we really want to ensure that as we're setting our budgets, that we're calling out, that we're specifying, every single activity that's aimed at males, because we want to really look back at our spend and say, did we spend enough? Did we not spend enough? Did we spend more than the previous year? Do we maybe need to shift less from one beneficiary group to another? There's no kind of direct question and answer. It's all just part of the discussion. But again, it's a way for you to understand how we're looking at your expenditures. You report to us on that cost category. So again, it's helpful for us at PEPFAR to know what are some of the biggest cost drivers. What are we spending the majority of our money on? And for anyone that may be taking a look at this and say, gosh, why do we spend so much money on supplies? It's because it's a little funny, but our ARVs actually fall under the umbrella of supplies. So, supplies are usually a very small amount of a budget, right? But you can see in this case, it's a huge amount of an expenditure. So that's just kind of one example of looking at our ARVs are technically under supplies. But if you take out supplies, Things like personnel. We know in PEPFAR, we're spending a lot of personnel or spending a lot of money on personnel. We want to understand that investment. We want to understand, have we increased our staffing footprint? Has it reduced? How much, are we spending on training or travel? Especially with a COVID year, being able to look at this and see where have our programs been impacted. We're seeing a lot less travel. We're seeing a lot less training. We're seeing, more in personnel, things like that. It's interesting to see how the expenditures have changed in something that is, a very extreme example, but it shows you in implementation how things can really be affected from year to year. Those are very basic examples, and I didn't want to spend too much time on all the data use, but this is another example of how we look at the data that you give to us, and that's when we're triangulating your data. Not every implementing partner has targets, but for those of you, let's say on this call, that have treatment targets, you're doing you have TX targets, you're doing you're keeping people on treatment. You can see here where we can look over time, and we can look at a number of different categories, how much you're spent, what your target achievement is. If your target achievement in that first row is for 2020 88%, you're not achieving 100% of your targets. Why? Why are you not achieving 100%? Let's look at your budget execution, and then in that next row, it looks like you left 5% of your budget on the table. You only expended 95% of your care and treatment budget. Is that a contributing factor as to why you only achieved 88% of your targets? And then we can do some other analyses, which is looking sort of at a cost per spend. And so that's things like, you can see here, these are the care and treatment sub-program areas, but we can say, we roughly spent $24.86 on a clinical services per every TX cur. And that actually got more efficient over time from 39 to 33 to 24. There's a lot of nuance and caveats and discussions that may go into that number. It's not the final number, it's not the only number, but it is one number that we can look at. And there's many, many, many ways in which we analyze the data. This is just an example of one of them. And then kind of the last thing that I'll talk about is, something that is increasingly more important to PEPFAR, which is really understanding budget execution. And so, we've talked a little bit about, we set budgets and then we expend budgets according to the same framework, essentially the same template. So we want to understand, how are we expending? Is it above? Is it below? Is it way over? And so this is another way that we're asking questions of, especially when we're triangulating with our results. It's really wanting to understand financial performance in a lot of different ways. It's not just looking at what you're giving us giving to us in your template, but it's also just understanding, how successful implementation is. The last thing I'll say is that, implementation is very, very difficult. And I, having been on the implementing partner side for two organizations, I completely understand that it is very difficult to get a lot of your operations going. And there's a lot of barriers and roadblocks, particularly what we're dealing with right now. And so it's understandable you're not necessarily going to spend all of your budget, or maybe you need to sort of pivot your program a little bit and overspend in other ways. It's very, very difficult to hit it 100% every time. We know that. And that's why, there is an allowable amount of interpretation in this. And I don't have like a range for you that says like, this is necessarily good and this is necessarily bad, because it's a start of a conversation and it's just one piece of information of a larger conversation. And I think I'll stop there. And I think actually one of my colleagues is on the line and was going to walk through how you as implementing partners have access to some of the data available on Panorama Spotlight. So I'll see if Ben is on the line.
Hey, Erin, I'm here. Good morning, good afternoon, everyone. Just to quickly build off of what Erin said around budget execution. So, when partners submit their templates, they're aggregated into data sets that we can use on the PEPFAR side, and also they post a version of the data for the partners to use, and it's on the Spotlight website. And so here's just where you can go to find it, and you can see it's aggregated to the mechanism ID and planning year level, and that PEPFAR expenditures are shown at the total mechanism level. Here's just an example of some of the visuals they have, this one focusing on budget execution. So here you can see it just gives you the total budget and total expenditure. Partners can review both their budget and expenditures as well, and they can also download the MER data sets that they can use to do any types of integrated analytics that they would want. So while it's not as complete as what we have on the USAID or PEPFAR side in general, you can kind of go in and review how your mechanisms have performed, both financially and programmatically. Thank you.
Great, thanks, Ben. And so I'll stop there and see if there are any questions on the data use piece.
Not specifically, but I do have a couple of other questions. Is the datum account for ER the same as the MER database?
That is a great question. They are not the same accounts. And so if you try to log in with your MER account instead of your, I think it's called a budget ER account now, you will have an error uploading your template. So more guidance on this to come as it gets closer to when you need to use that account. But that's a great question that if you have a MER account, you will only be able to enter in targets and results. And so if you need to enter in, a budget template and an expenditure template, you need a separate account for that. And again, we'll give you more guidance on that as it gets closer to when you'll actually need to do that.
Okay. The next question is specific to a fixed amount award. So where deliverables are matched with contributions from USAID based on the deliverables. So the question is, how can we reconcile the relationship between intervention-based and milestone-based interventions in the FAA?
So I think, regardless of the contract type, you are required to report to expenditure reporting. And so, I understand with certain contract types, it might be a little bit more difficult to understand how that translates into an ER template with interventions. But this goes back to why we say it's a best estimate. And so, that's, thinking about things like your percent level of effort in a particular, if you're working on a report, and it covers multiple, it's sort of like a clinical component. It's got a little bit of treatment, a little bit of testing. Maybe you just, will sort of log your time like 50-50 or something like that to complete a report. That's just an example. Again, use your best guess on some of these allocations. And it's part of the understanding that, we understand it's not going to be entirely exact. Also, don't hesitate to reach out to your ACOR on how to report either, because again, you should be reporting how you're spending, but if there is a decision point to be made on, should there be, more, actually, we know that we're focusing on care and treatment. We do a lot of care and treatment. We can't specifically tease it out. Then maybe it makes sense to set a defined allocation percentage with your ACOR to say, let's divide it up this and this amount. And that's what I know you do as a partner. And that's, reflective in your expenditures and things like that. So, don't hesitate to have that conversation with your ACOR as well if you get stuck on determining how to sort of, for lack of a better word, kind of cost share across the interventions. But regardless of the award type, you need to complete according to that framework, the template according to that framework.
Okay, and do you recommend any software for a proper cross-sectional reporting?
I do not quite know the specific context of that. I think I can really give. I can't really give any good recommendations on software. Every organization is different, and it's not. USAID chooses to not be really prescriptive on what we think you all need to adhere to in order to complete ER. So I would, reach out to, maybe the folks at ASAP can link you with other implementing partners, or if anyone else is an implementing partner that has an answer to that question and you want to answer it in the chat, that's helpful as well. But unfortunately, I don't have a great recommendation for you in that sense.
Okay, and thank you, Karen. Yes, ASAP can help. And perhaps we should document more the process of PEPFAR expenditure reporting in preparation for this year's timeframe for October. The last question in this series is back to finances, and it's talking about how the budget constrains activities, program activities. And what is your opinion on the relationship between program planning and budgeting? And I think this is a very important question because it reflects how important your budgeting process is upfront. So you make sure that you're covering all your costs for your activities, but sometimes partners find themselves in need of doing more than what their budget allows, which isn't necessarily an ER question, but rather a budget modification question for the AOR. Do you want to add anything to that?
Yeah, I mean, I guess that's a good point. I mean, I think when, with PEPFAR, we just unfortunately, we for many years now, we've been operating at a flatline global budget, and the targets continue to go up globally, but the budget stays the same. It's been like that for, I think we're probably going on 10 years now. So we're doing the best all of you are doing the best that you can with the money you have. And the reality is that, it's probably not enough. And I think, we're all understanding of that. And I think that's why in PEPFAR, we try to take a data-driven approach to budgeting. And we try to look at how much did you spend last year, and what was your total ceiling amount, or what do you have available, what is still in the pipeline, how did you perform? It's a conversation that I think that's why communication with your ACOR is very critical, because I think there's sort of the more budget planning from the operational side, which is really critical, but it's also, if for when we're doing this budget execution exercise, and let's say you're monitoring on a monthly basis and you're thinking, gosh, we're getting really close to what we told USAID we'd spend on care and treatment. We're worried. We don't think we're not going to exceed our total amount that we're obligated for the year, but we're worried that we're running out of care and treatment funds. That's a conversation that you certainly should have with your ACOR, because there's, certainly room for understanding that at the end of the day, when we do a budget execution comparison, I do not want partners to feel as if you just need to give us a carbon copy of your budget template. We need to know what's going on. And let's say that example that I gave, that you only had 88 target achievement, and yet let's say you spent 100% of your funds, or maybe you spent 50% of your funds. I mean, the question is just sort of, maybe you didn't have all the funds you needed to achieve your targets. Maybe you had too much in testing and you needed to shift more to care and treatment. And that doesn't have to be a formal process, but we would rather see that you overspent on care and treatment and underspent on testing, because that's what happened. Not that we want to just see 100% across the board. We want to know what happened. We can't help you and advocate for funding and advocate for change if we don't know what's going on and we don't know where there's problems. There's overspending, underspending. Now that's on an ER level. Of course, you are required to stay within your obligated amounts. You're required to ensure that you're not going over what you're obligated. You will not be reimbursed for anything that has not been obligated to you. So that's just why it's a difference between kind of the financial compliance side and the data side. They're very different, but have that open communication with your ACOR on what's going on, and have it often and early, because sometimes it can be too late in the year to really address any issues.
Thank you, Erin. Back to your presentation now.
Great. Just two more quick sessions. It's really just one session here. And I've kind of talked a little bit throughout the presentation about the work plan process. And so again, that's basically what we're going to start doing it'll probably start in May. And that's after part 1 has finished, which is what we're doing right now. And so that's when the implementing partner will work with your USAID ACOR to basically give us a package of information that says, what am I going to do as the implementing partner in the next fiscal year? So that will start in May of this year in anticipation of the work that you will be doing starting October 1st. So all of this is in advance of the year beginning. So there will be fairly certain there will be a separate ASAP webinar all about the work plan process. So you don't have to, worry about jotting everything down now. We'll give you that information as we know more as it gets closer to work plan time. Nothing to worry about for right now. But in general, as a partner, we need to have some kind of agreed upon understanding as to what you are going to do in the next fiscal year. And that's basically going to be in a form of a narrative that details kind of the landscape, it details the targets that you're assigned, it's going to be detailing the strategies and the activities, where you'll be working, things like that. That's a narrative, that's standard. You'll have a budget narrative, which will sort of describe your budget, how many people you're hiring, if you're purchasing a piece of equipment, things like that. And then you'll have it's called the budget and projected expenditure template. But again, you can see in this right hand kind of snapshot, it looks just like the ER template. And again, the budget template looks just like the ER template because we do that budget execution exercise. We need to ensure that you know exactly what that you are clear on what you're going to be implementing in the fiscal year according to your interventions. So this is a blank template, but it's no different from kind of those boxes we've seen where I said, you'll get that information from your USAID ACOR in May. So, don't worry about it too much for right now. The good news is expenditure reporting is basically the mirror image of work plan budgets. It's just setting a budget versus reporting expenditures, but it's essentially the same documentation, it's the same process, it's the same everything. And so that's coming down the road in a few months, and we'll get back in touch when you'll need to know more about that. And maybe I'll just go and finish here with just a couple of closing comments, and then we'll take the rest of the time for any questions. But I recommend, as I said, that you get together as an organization, particularly if you are a new organization, and discuss internally what you need to do to prepare for expenditure reporting. And does that mean that you decide on there's going to be a meeting once a month or a meeting once a quarter where you're going to reconcile the finances with the program implementation? And so you folks need to get together and discuss what that looks like. Some partners like to complete an ER template 4 times a year, so that when it comes to reporting, all they do is just aggregate all the templates together, and then they're ready to go because they've been doing it on a quarterly basis. Some of them find that easier than sitting down October 1st and pulling out all their records and saying, gosh, what did we do a year ago? And so I would just internally take the time now to think about the smartest way for your organization to really institutionalize expenditure reporting. It will become, an annual requirement that you will have to do. So you might as well start now thinking about what is the smartest way for you to do it, and get that going. I think the other thing that you can do right now is that, and I think most of you actually probably should have this, but ensure that your ACOR or activity manager has given you your COP20 fiscal year 21. That's the year we're implementing right now. Make sure that they have given you your budget by intervention now, because again, we want to see the expenditures as they happen, not just what you want us to see. This was our budget, so fine, we'll show you the exact same thing, the budget. We want to know what happened, but it's good to know now oh gosh, we thought we could spend more on care and treatment than what we have, or oh, we didn't realize we also need to spend money on adult women. And so it's good to get that expectation clear now, so that it's not sort of a surprise down the road when you have to do ER, or kind of the worst case scenario, which is a budget template looks one way and an ER template looks another way, and there's basically just no cohesion to it. And then we're trying to understand, why did you implement this way when we expected you to implement this way? And that's just a communication issue that just needs to be sorted. So I would just be sure that as an organization, the year that we're implementing right now, what is your budget by intervention, so that you're clear October 1st what generally the guardrails are for your budget when you sit down to do your ER reporting for fiscal year 21. And then I've sort of referenced this website all throughout the presentation, but I want to make it very clear that when I mentioned that there's definitions and examples of activities and examples of what is included or excluded, you basically want to refer to what is called the PEPFAR Financial Classification Reference Guide. It's about 100 pages of really light, easy reading. I'm just kidding. It's very dry, but it's a really good reference for you to be able to answer some of these questions on, where does VAT go? And what is the difference between a healthcare worker and an ancillary worker? Where do I put that money? So if you have those questions, and you will have those questions, you can go to this website here called datum.zendesk.com, and you can see I've highlighted here, there's one section on PEPFAR guidance, which is where the PEPFAR Financial Classification Reference Guide lives. And then we talked about, you must submit your template in Datum, and then you can see on the left-hand side there's a whole separate guidance, set of guidance documents on how you'll actually create an account in Datum and upload and submit your template and all of that. And then, the last thing that I always want to make a plug for is that there's always technical issues, right? We always have, my template's not working, I forgot my password, something's going weird in the system. And so you can see down at the bottom right there, it says submit a request. And that's basically a help desk ticket system that we have. And my answer when people have questions, especially technical questions, which is like, I don't know why I can't log in. I don't know why you can't log in either. So go ahead and submit a help desk ticket. And that is 90% of your questions can be answered by a help desk ticket request. So I'd say, bookmark this page. There's a lot going on right now. There's really nothing required of you regarding reporting at this time, but maybe, get familiar if you can, scan through some of what's available and kind of bookmark it and know that it's available for you at another time. So I know, maybe Catherine, I'll defer to you as to whether we have a lot of questions in the queue, or whether you would like to maybe spend like 5 minutes or so, if there's any implementing partners that want to share any kind of experiences with expenditure reporting the first time. It was really awful, it wasn't that bad, this is what we did to make it easier. What would you prefer, Catherine?
So I have 2 questions for you, and I think your idea is great. I would like to point out that we have launched our poll, so please take the time to answer our short questionnaire on this webinar. It helps us improve future webinars. So the next question is a perennial question. What would be the maximum allowable budget to be allocated for program management?
Right. So if you remember that USAID is setting your budgets by intervention, and that includes program management. And this is why reporting accurately to expenditure reporting is important, because we will essentially, we certainly verify what we are contractually obligated and required to pay you, and we will ensure that that is covered. But we typically will refer to the percent of your total spend last year as a starting point. And so that's different for every organization. Maybe for local partners, I mean, yeah, I guess it still holds. I mean, it's still different for every organization when you consider there's hundreds and hundreds of implementing partners that are operating all over the world on completely different cost structures, small, large, in, very rural areas where you may be based, or very large urban areas where you may be based. And so, there's not one number, there's not one limit, there's not, it's different, other than just saying that, we look at the percent of your spend allocated to program management costs, and that is our starting point for budgeting your program management for the next year. The only other thing I'll say sort of regarding high program management, no one has ever said this amount is high. That does not exist internally, externally. No one has ever said that. That being said, I think at some point we all can think about, if you are implementing at 45, 50% program management, that's saying that 50% of the work is not going to a beneficiary. It's not going to people living with HIV/AIDS. It's not going to prevention of HIV. It's going to your organization. And so I don't think, that's necessarily what we want to be doing in PEPFAR, and is paying for admin and operating costs. And so it might be a misinterpretation of guidance, and that's often what we see when we do see partners that report 40 to 45% of program management. It's often a misinterpretation, and they don't realize that some of the costs that they put in, or expenditures that they put in their ER template for program management actually can go into some of the interventions. But yeah, I mean, like I said, it's for me, anything kind of that's certainly on the closer end to 50%, it really starts to make you wonder what that partner is doing to contribute for getting us closer to epidemic control. I had one other point about program management that I forgot, but we can go back to it.
Okay, I'll just add that at the recent USAID local partner transition meeting, USAID did present the differences between international partners and local partners in terms of program management, stating that local partners have a lower program management cost and are more efficient. However, you could look at it like that. However, you could also look at it that because local organizations haven't yet started using the 10% de minimis or applying for a NICRA, once they do, those costs might be closer together. It's also a good, very important piece to keep in mind when you're developing your work plans and budgets, to make sure all of your project costs are covered. The US government is obliged to reimburse you, to pay you to do all the work under the award. And sometimes, with experience, you learn what else you need to include in the budget. So the next question is
Catherine, if I can maybe just add one thing,
sure.
Maybe two things, but the one difference that we do see regarding high program management is in conflict countries. So, in a country, let's say for example, South Sudan, that's where we are, again, this is a discussion to have with your ACOR, et cetera, but, there's additional costs there of doing business. And so, we would not expect to compare the program management, budget and expenditure to other countries, because of, you have different requirements in order to keep staff safe. So that's sort of one reason, again, why we don't like to compare program management across countries, because context is very important given what's a lot of the country context.
Thank you. That's a very important point. The next question is for international partners. Should line items like personnel and travel include headquarter costs or just field costs?
It's any costs that are directly, related to the implementation of that award. So if you have someone from headquarters from your organization that flew out to, Nigeria, and they did some local travel and they incurred some expenditures related to materials and supplies, things like that. absolutely, that's recorded. Their time is in the budget as a direct cost, and their trip is an international, ticket, and their local travel is a domestic travel. That all needs to be included. If it's directly related to, if their time and their materials expenditures are directly related to the implementation of activities. It gets a little different for, like, every now and then, like an executive will do a site visit or something like that. And, that's where I think it gets a little bit more kind of in the weeds, because often their kind of cost structures are rolled into a NICRA or an indirect cost. And so it might not all be directly related to the activity to do a sort of an executive level visit like that. But I think that that's certainly a conversation to have, maybe with the ACOR or just internally as an organization. But typically speaking, just like a technical advisor or a research assistant or something like that, who might be going out to do a trip or something like that, then it's certainly included. And even if they're just sitting at headquarters and they have, 5% of their LOE is allocated to the project, just sitting at wherever the headquarters is, that's if it's directly related to the implementation of the activity, yes.
Thank you. The next question is about accounting systems. Is cash basis accounting system mandatory, as some implementing partners have the modified one?
So I guess as an organization, I'm not an accountant. I do not have an accounting background. As an organization, kind of generally speaking, I think you make that decision as to how, you choose to operate on a cash or accrual basis of accounting. That's an organizational decision from a sort of a, general standpoint. For the purposes of reporting to ER, you must report according to a cash basis of accounting. That goes into some of the interpretation of the expenditure, is knowing that it's cash basis. That's how we interpret it, is knowing that, from October 1st of 2020 to September 30, 2021, we know this is the exact amount of money that left your bank account, and not just an amount that was accrued, but how much actually left your bank account.
Okay, thank you. So on to your next point. If anybody in the webinar would like to share their experiences on submitting the PEPFAR expenditure reporting last year, if you could raise your hand, we would love to hear from you. We will also be glad to include local partners in our next presentation on expenditure reporting, so that your experiences can help inform newer local partners. So I am not seeing any hands raised right now. While we're waiting for hands raised, may I ask the other panelists from Sustainability Solutions or our capacity advisor, Desiree Zongo, if they would like to add to any of the questions that we have answered, or share any other information you think local partners should hear right now.
Catherine, it's Doug here. Greetings, Aaron. I think it was a fantastic presentation. And I would like to echo your comment about the right time to consider that is when you're preparing the budget. The finance team can work with the technical team at that point to see what are we spending the money on. So later on, I mean, during the beginning, the finance team can understand what's going to be expected of them later. So I think that is critical. Also, Catherine, I think you mentioned about the allocating of your costs. Those, as you indicated, Catherine, if people are, and Aaron, if you're getting 40, 50% overhead costs, you're probably not understanding what is allowable and how to allocate your costs. So if people are taking notes, that would be in your 2 CFR 200 cost principle 405, right up front, A 1, 2, 3, and under D, it's very clear the U.S. government will pick up its fair share of those costs, And so don't just lump them all as overheads. Try to allocate them, as you said, Aaron, if it's related to a certain type of activity and can be done, as you showed in your spreadsheets, that would be the best way to do it. Okay, that's really, I think it was quite clear. I look forward to seeing how people do this, going forward. And, I know ASAP certainly has a lot of ways that they can help people. So that's my 2 cents for now. Thank you.
Thank you, Doug. So we still have no hands raised for sharing experiences.
Catherine?
Yes, Doug.
I think one other point, a few people did ask about the exchange rate. And if, just similar to when you're going to a recipient, a non-US recipient will have their, locally incurred cost audit or yellow book audit, and they're receiving dollars, converting it to local currency. The rate to use would generally be the weighted average method, which if you draw down $1,000 and convert it to whatever, X shillings, kwacha, nara, over the course of the year, you record how many dollars you've drawn down, record how much local currency that related to, and then divide the total local currency by dollars. That would give you your weighted average rate, and that's the rate that most recipients use for their audit reporting on the financial side. That would be certainly adequate for the expenditure reporting, I believe.
Thank you, Doug. So at this point, we do have one hand raised. Let me see if I can find it. Damiana, would you like to unmute and share?
Hi, morning everyone. Good afternoon. Thanks so much for the presentation. It's quite useful and very interesting. Just wanted to add on the preparations for the submission of the expenditure reports. In my past experience, I've seen situations where partners wait all the way up to the end of the year, as I've heard, and that gives a lot of pressure, because you don't have enough time, and it's a period when you're also reporting we're also doing the annual reports, October to December. So it becomes so busy such that, you can miss out on so many things on expenditure reporting. So I agree that you don't need to wait until at the end of the year. You can do it quarterly, or you can do it biannually, so that, you don't lose track and you don't spend too much time, at the end of the year. I've seen, reports sometimes which come late and they have a lot of errors, a lot of problems. It gives a lot of, pressure to actually resolve those issues, last minute, and you end up having a lot of back and forth with USAID to correct those errors. So it's important that we do these things early. If you can't do them quarterly, do them biannually, so that at the end of the year you are on track and you are in good shape. Yeah, thank you.
And if I can maybe just add on to what Damiano just said, if you remember the slides I presented on data use, we're looking at this, right? So it makes it very difficult for us to look at your performance indicators in other areas, and to, if you're missing 50% of your expenditures, it's difficult for us to explain that, especially when we're, when we're having a lot of our COP planning discussions, and a lot of people are looking at data. Maybe not just, we're not necessarily talking about you and every single person individually, but when we do tend to start seeing kind of issues in the data, and we do look at a certain partner, it's hard for USAID to advocate when the data is wrong, because that's what you submitted to us. And so if that's what you're saying you spent and how you spent it, we're going to trust that that's accurate. We'll review it to the best of our ability, but you're the one that spent the money. So, I think just remember the data use piece, and that we can only advocate and talk about what we have in front of us. So as you're doing ER, I understand everyone has more work than they know what to do with. It's all throughout the year, I understand. But if you can find a way to work smart and not hard, I think, and find a way to do it, quarterly, semi-annually, it will pay dividends for you in the long run, and you'll have data that you're happy with.
Okay. Thank you. We have another person who's raised their hand, Katie Simon. Would you like to go ahead? Katie, you're on. You're on mute again. Okay, that's not happening right now. Erin, is there a place that people can email questions about PEPFAR expenditure reporting?
We don't have, so I would say the short answer right now is to go through your ACOR, who will put you in touch with the headquarters person. My team, we're a team of 7 or 8 people now. And so if you have specific questions, you can go through them. When we send out the materials, I can make my information available if folks want to directly contact me as well, if that's preferred.
Okay, thank you for that. Well, I think we're at the end of our presentation. There's no more questions. I want to thank you, Erin, for yet another great presentation on PEPFAR expenditure reporting. It is a very complex task that all implementing partners are required to do. As I said, we will repeat this webinar closer to the time of when you will be submitting your next round of PEPFAR expenditure reporting. Thank you, Ben, for joining and asking, providing some information, and to our other panelists. And thank you everybody for joining. Again, we will send out all the questions written up, and we will include Erin's information if you would like to send specific questions. So thank you everybody, and thank you for completing the poll. Have a great rest of the day, keep safe and stay healthy. Bye-bye.